I thought I would share this experience because it's different to what I've seen. Okay, I've not been there, but it's different to quite a few American experiences. I know this because the only SI joint group I could find, no, it's not an SI joint group, but the only group in which I could ask about the SI joint infiltration was in an American group. And so, you know why? So, I was part of a South African group. There's only one busy or currently active South African Facebook group. But what I noticed is that there was some, yeah, this is South Africa, though that there was a sort of apartheid going on. And the last straw was when a new member, very new to AS, a black member, asked, I don't know what she asked, but then I answered and said, I'm sorry about the pain you're going through. Are you on medication? Have they tried this medication? What experiences do you have of it? Any side effects? It was something like that. And then the chairwoman comes along and she says, don't mention medication. And I was thinking, but all the other non-black people have been talking about medication. How else would you talk about fighting AS if you're not talking about medication? Because that's how 99% of us are treating it, with medication. And I took screenshots of all the non-black people who were talking about medication. And then I said, I've spotted how you guys don't answer questions asked by black people, and then you come down harsh and make rules that are not actually true and fair. And so you guys are racist. I'm gone. And like 2 months later, the poor woman finally responds and said, please, she wrote to me privately. And she said, could you please start a group for black people who have AS? And I told her, if you can find 5 people, and if I can find 5 people who have AS who are black in South Africa, then we will do it. And she said, yeah, she was really irritated because she had also seen that everyone else had been talking about medication they're on, suggesting medication, asking about medication changes. And so her question was, why was it that when she asked the question, I was not allowed to talk about medication? And I think that's sad because we need help, and information is quite country specific, especially for us third world nations. It is very specific. But yeah, I don't know any other black people besides her who have AS. There's one man, but he doesn't seem like he's a group kind of person, who is in Johannesburg, who I do know has AS. So that would make it 3 people. And that's not much of a group. There's also one black man on a website, but he's not active there either. So anyway, so I'll talk to my American people. I asked about SI joint infiltration, and specifically my question was, how many of you drove yourselves home after your procedure? Because when I Google, I see so many doctors saying you must have someone to drive you home. Quite a few people are sedated for the procedure. Now, this was the second time I was getting it done. The first time was horrendous. I did it at, I think it was Netcare Bloberg. If I didn't, I'm sorry. But I believe I had it done at Netcare Bloberg in the radiology department. It could have been Milnerton Mediclinic. Those are the 2 that it could have been at. And I went in. Now, they don't prepare you. No one tells you anything in advance. They just tell you, your rheumatologist tells you, well, this is what has happened to me in Cape Town with 2 different rheumatologists. Rheumatologist tells you, all right, I think you might be benefited by having this SI joint done. The first time was one side, my right side. It was the worst of the 2. So you go, and the plan is for you to have a steroid injected and pain medication. It might work. Firstly, it might not work. So you might go and do that, and it might not even help. But what the aim is to reduce inflammation in that joint, and thereby also reduce the pain. If it works, it might work for 1 week, 2 weeks, 3 months. It won't work and last long. The effect won't be long. Or it might only partially work, so it might only reduce the pain a bit. If your pain scale is a 20 and it suddenly goes down to 15 on a scale of 1 to 10, it's not much of a difference. And that's where the struggle was for me, in that it's not like it miraculously got rid of all the pain that first time. So it's only when the effect wore off that I realized, oh, it had reduced the pain. That's how bad the pain was. You can't really tell. It's just help, help, help. That's what your brain is screaming. So the first time I went to that hospital, they do it under CT guidance. So they use the CT scan machine, whatever you call it, so that they can get the placement directly in your joints. Please go find a picture of SI joints, sacroiliac joints, so that you can kind of picture where it is. So you're lying on your stomach and your arms are up like this. Your arms are up like this by your head, and you're lying on your belly on a narrow bed. And because they have to go in there, you are naked. Well, you open at the bottom. You're wearing the typical radiology gown. You're topless, wearing the radiology gown open at the back. What I hated with those people, one of the things I didn't like with the first person or the first procedure, was they left me exposed. So they came, they did whatever, I think they cleaned me, and then they just left me exposed, open, like that. And people going in and out the room. It was really degrading, really degrading. Please don't do that. And then the doctor came, I don't even remember his name, and he then did the procedure, but he never told me what he was doing. I just would feel this prick and I'd think, okay, that's it. And then it would get worse and I'd think, okay, now it really must be the end. It was horrific. It was just bad. And I thought I would never do it again. But AS doesn't take a break. It's gotten worse. The pain has gotten worse. So I went again last week. This time I went to SCP radiology at Panorama Mediclinic. SCP radiology, Panorama Mediclinic. This was miles better in terms of the people, that the way they acted. I really appreciate how they acted. I still don't like that we don't get any warning in advance. Back to the group. So in the group, I asked about it because I kept seeing that people shouldn't drive home alone, and many Americans were saying, no way. Well, some did say they did drive themselves. Others were saying, no, you can't. I always have someone who drives me. Plus, many of them get sedated for the procedure because it's horrible. It's painful. That thing goes deep into your joint, people. It's not for the faint-hearted. So one was asking, but will insurance pay if you get into a crash and you've just had the procedure? We've never had that kind of discussion. So that is why I'm sharing my experience, so that we can see how different they are or how similar they are, if it's similar for you. So I went there. I went to the radiology department at the hospital. I told them why I'm there. Before that, I had to book a date because it's under CT guidance, so a doctor has to be there. Well, you book for MRIs too anyway, and mammograms. So it's not only because a doctor has to be there, but yes. So I got my date. I emailed, they gave me a date. They asked for the referral letter. I sent it through via email. I went in. The woman, I think she said her name is Shireen. Yeah, it sounds like Cherie. She's a plump colored young lady, and thank you so much. You really just already, I actually even typed to someone and I said, I hope the doctor is like her, because then we're already off to a good start. She had such a bubbly and calming and relaxing personality. She told me everything she could tell me in advance, told me where to get undressed, what to get undressed in. She was friendly. She reduced the anxiety. I hope your name is Shireen, if you ever get this, or otherwise it's Sherry. I know it's Sh. I think, forgive me if it's not. So I got undressed, and then she came and told me there's a patient busy in there, but I'll be called soon. Just those little things. So I know I'm waiting on what I'm waiting for. And then she came and got me in, and then she warned me, which no one had before. She warned me that I will feel like I'm numb like my legs are paralyzed, but I mustn't be scared. It will wear off. Tomorrow I can go back to normal. And I was thinking, okay, now you people tell me that my legs can have no control. I hope this begins after I drive myself home. So now I see why some people get told, don't drive yourself home. It was a bit nerve-wracking, especially given it was going to be both legs. So both, like from your bum. It, I thought, okay, this had better happen once I'm at home, because this is a bit worrying. So you go in and they inject. So yes, so they came, I lay down, sorry. And the nurse lady, Cherie, or whoever she is, and different nurse, I think, I was on my bum with my arms up, so I couldn't see. They came and they said, okay, now we're going to clean the area so that it's sterile. Clean it with antiseptic or antibacterial or both. And then they covered me up with something sterile. It also made a big difference to be treated with dignity. It really did. Yes, I would be exposed again when the doctor comes in, but to minimize the lack of dignity makes a big difference. I appreciate it so much. And then the doctor came. He came around because I'm lying on my stomach, yes, towards the CT machine, arms up on a pillow. And he came, bent down, and he said, he's Dr. Van Rooyen. There, I remember his name, Dr. Van Rooyen. And he was telling me, he told me what he's going to do. I appreciated that. I really did. I'm one of those who actually wants to know what you're going to do. So even when I'm with the dentist, when you're going to drill, tell me I'm about to drill. Tell me, okay, this is the whatever machine. I'm interested. I really am. So he started. He told me we're going to now inject you with a bit of something. Lidocaine, I can't remember what he said, to numb my skin, because they can't really numb a joint. And then they did. It stung. And everything is twice. It stung. It felt like it was spreading over my rear. And then he said, okay, now we're going to put you in the machine so we can see where exactly we should be. And the lady had also warned me that, of course, this is AS, ankylosing spondylitis. So your joints do fuse. So you might not have space in the joint for them to put the needles in. So yeah, so they found the space, and then he would keep telling me that, okay, now we're about to move you back out and back in, and now we're going to put the actual pain medicine and steroid in. Thank you so much. It was horrible. The pain was not nice. It was like they're drilling into my bone. It feels like they're trying to get into your bone. So yeah, and for me, the deal breaker was my arms. That for me was the deal breaker. That experience was actually worse than what felt like digging into my bones or drilling into my bones. As you know, the disease has progressed and it's caused stiffness in my shoulders. Lying like this, forcing them up like this. It was bad. It wasn't like this last year when I had it done. Obviously, as I said, things have progressed. So the pain was horrific. And because I had to lie like that, because I'll be going in and out the machine, I couldn't pull my hands down. So by the time we were finished, it was almost like they're stuck up there now. I couldn't bring them back down. And my shoulders were screaming. And the ladies asked me, are you okay? Are you okay? And I said, no, they thought maybe I was dizzy or something. I said, no, it's my shoulders. They are arthritic. That's the only thing I could say that's fast. And yeah, the pain holding them up. So I don't think I could ever do that again. It was too painful and scary too, because you can break your bone. That's the thing. It makes your bones not brittle, but they are easily fractured. It's easier to fracture them when you've got AS. So I was also scared that, okay, if I force it and then I go, I don't know if that happens to your shoulders too, or only your spine. I know it can happen to your spine. That's why we're told not to carry heavy things. So yeah, that was my experience. By the time I walked out, my left leg was stiff and I couldn't walk fast. It was falling asleep already by the time I had to go to the car where I had parked. So I had to, and I tend to walk fast. it was weird walking slowly and not being able to control the speed of my leg. I had to limp across the pedestrian crossing. I guess it's a hospital, so it was good. I looked sick. But thankfully, I made it home okay. By the time I got home, Panorama is around 20 minutes away from my home if traffic is clear. And by the time I got home, my one leg was dead. So I had to, it was a matter of feeling, and I stumbled, especially going up the stairs. So my daughter, my teenage daughter, helped me come into bed. I said, okay, guys, I just need to lie down because if I fall, this will be just a mess. So I got into bed, and my poor Mikaya, my 8-year-old, they all follow me. And he says, this was around 1:30. I make this up at 5. And he says, but Mom, if you can't walk, who will make our supper? Sorry, it just sounded so bereft. It was so cute. Who will make our supper? But I said, well, I don't know, because I didn't know whether I would be able to walk, whether it would be my son, my oldest son, or my daughter, though they're always usually out and I make the supper while they're gone for a walk. So I told him, I don't know, Mickey. And he says, oh, well, someone will make our food. We won't starve, talking to himself. And out he went. It was so sweet, my poor innocent boy. But yeah, by 5, or 4:45, I was walking fine. My foot, it was only my foot on one side that was numb. And seeing as you've got a leg going down to your foot, this part could feel, my leg could feel where I was stepping. So I was fine. And that was it. The pain did increase a bit. It has increased a bit, but overall, no side effects. It did feel like my bones are grating on each other for maybe the first 2 or 3 days. As for pain reduction, I honestly don't know. When one of what I call my brothers, well, he's the only brother I have really in terms of caring about me and my family. He's not blood. When he asked how the injection went, I said, I honestly don't know, because there's so many other bones that are sore that sometimes I just feel like giving up. What's the point in reducing pain in one when everything else is getting worse? And I laughed in a cynical way, with the irony, because a post a day later in the AS group for women, a woman asked, is there an option? Can we just give up? Is giving up not an option? And I thought, that's exactly it. That's what I told my brother. It's just like, I just feel like I just want to give up, because really all we're doing with all these infiltrations and injections, just firefighting, and another fire is blazing elsewhere. It's not nice. So yeah, here I am. I just thought I should do this now so I can lie down quickly. Yesterday was horrendous for my SI joints. So that's why I'm saying I don't know if it is better, because I really punished them yesterday, so it's worse than I would feel if I hadn't punished them. I had to drive my daughter to Somerset West, which is 60 kilometers away, one direction. So it took us an hour to get there. And then I had to wait for almost 2 hours for her to do her biology practical exam preparation. And then driving home was an hour and a half because of traffic. There was a lot of sitting, a lot of pain, a lot of pressure, and I'm feeling it today as well. So that's why I can't tell you if it has worked, because I also have punished myself. All I know is I'm in worse pain today than I would be if I hadn't gone. But it has to be done. 2 more trips, 2 more Tuesdays for her, and then 2 more Tuesdays, and then that will be done for her. So it's temporary, but it's hard. It's horrible. It's horrible. Friday is surgery. If you love me, if you're a Christian, pray. If you aren't a Christian, please think good thoughts. This is the first time ever since knowing my husband in 25 years. This is actually the first time. I thought it was since 2000, but no, since 1998, since 1999. This is the first time he will not be there for any surgery. Since 1999, he's been there for all my surgeries near me, with me. But he's not in the country. So wish me well. I hope nothing goes wrong for the sake of the children as well. My son will come and fetch me. He's 18, turning 19, so I will be allowed to be put in his care. Thank you for listening. Let me know for you how your SI joint infiltration went. I know also that when I saw some research in some news article, and it said it's really damaging for the joint, so don't do it often. They were really saying don't do it. And HA is a better option, hyaluronic acid, to do it as opposed to with steroids, which is what we use. Let me know if you're in America and you've had this done, or in any other country that isn't South Africa, or even in South Africa. What did they use for you? Did they use a steroid? Or did they use HA, which is much safer and kinder to the joints? My thinking was, either way, my joints are damaged and they're becoming more damaged. That is the disease. So is it any worse to damage them? Like, will it make any difference? It's damage either way. So yeah, but I'm not going to do it again anyway because of my shoulder, and it's not that useful because it doesn't last long. So there's no real point in doing it anyway because the effects don't last forever. And thirdly, all my other joints are so sore anyway that, yeah, it doesn't really improve quality of life. That's it. It doesn't really improve quality of life. It's, for me, not worth the cost. But I'm still grateful to Dr. Van Rooyen and Cherie at SCP Radiology.